There's a disconnect between what hospitals are reporting and what's happening outside of those walls. That's why we brought our cameras inside the ICU to see for ourselves and to share it with you.
What's really happening to people in our community and to the professionals taking care of them? But going inside an ICU is far from normal. Before we show you, our news director Melissa Luck explains how we got here.
In almost 20 years as a journalist in Spokane, this is a story I never thought we'd be able to tell. A story with cameras inside an ICU. But a couple of weeks ago, the situation seemed so dire, we reached out to the staff at Providence Sacred Heart Medical Center, and we made a simple request. Let us inside to show the reality of healthcare during COVID-19. Requests like that go right up to the top, to the team that includes nurse manager and COO, Susan Stacey.
What makes the hospital okay with, bringing cameras into the ICU and showing some of what's happening?
So if you'd asked me to do this 2 years ago, I would have said, oh my gosh, we would never let cameras in our critical care units.
But this is not like any other time. Providence Sacred Heart has more people with COVID in the hospital than any other time in the pandemic. Of those who come in, many never go home.
We felt it was important for our community, who doesn't always see what we see every day in terms of the suffering of our caregivers and the suffering of patients and families during this time.
From the beginning of our discussions, the hospital's goal was clear: protect patient privacy. Beyond that, they were open to letting us simply show and tell what was happening inside the ICU. And to hear the stories, the heart-wrenching stories of the nurses and doctors and therapists now 18 months into a pandemic.
I can't even imagine what they've been through. I'm here in this building, and I can't imagine the pain they see every day.
Susan knows it's hard for you to imagine, too, what happens in those dark moments. She hopes by seeing it, maybe they'll change some minds and some hearts.
I hope that the message is received, that this is a sad time for us in healthcare, to have a preventable disease that people are choosing not to prevent.
And as unusual as it is to have a camera inside an ICU, Providence really let our crew have free range on the floor that day. As long as they were masked and protected, as long as we didn't interfere with patient care, and as long as patient information was kept private. For the first time in my career as a news manager, I let an organization screen video before you see it. Providence is doing that only to make sure patient information is protected. Other than that, Providence is letting us and the caregivers tell the story. I'm Melissa Luck, 4 News Now.
We're putting the finishing touches on tonight's special report.
Robin Nance is getting us ready to go inside the ICU.
And it was something I will never forget. Throughout this pandemic, and especially recently, you have heard of our hospitals being packed with COVID patients. But now, how can you believe it if you don't see it for yourself? And how can you fully understand unless you hear directly from those on the front lines? Some nurses in the ICU shared what they are dealing with, from procedures and treatments to the heartbreak of losing patients.
They held a big family powwow, right? I got grandkids, I got brothers, sisters, nieces, nephews, grandpa, grandma, all in the room. It's like, this was when I was working nights, it was like 2 o'clock in the morning, and I'm explaining to them that I'm sorry, mom is dying, right? And to hear those kids cry is something you can't get rid of, right? That's gonna stay with me forever, sadly.
Yeah, this is a story I promise you will not want to miss. I will be back with a full report tonight on 4 News Now at 6 o'clock.